You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. What is the next big thing that people should consider? Because there is an order to this. And so you get this comprehensive stool test done, and let's say somebody has the GI 360. What's the next likely thing, or the thing that you see most often that people frequently miss?
Well, I'd say the three top big diagnoses would be SIBO, small intestinal bacterial overgrowth, which could be different types of bacteria, but that's specifically when bacteria gets lodged at the very end of the small intestine, right before it becomes the large. And it has a very clear constellation of symptoms that's usually fairly easy to differentiate. And then a SIBO breath test would tell us exactly which kind of organisms are there. And that gives the practitioner a better idea of how to treat it. So that's one. Yeast, which we already talked about, and mycotoxins, which could cohabitate. And then parasites is the other big one. And parasites are probably the trickiest and hardest to identify because there's no stool test that really identifies them well. And just like yeast and microscopic parasites like blastocystis that lodge in the gut lining, things like worms and other types of parasites also lodge in the gut lining, both small and large, and they don't often come out in stool samples. And because they have life cycles, the larger parasites like worms actually lay eggs, and there might be a shedding phase where the eggs are coming out, but you rarely see adults. And people think that if they don't see worms, they don't have them. I can tell you that's not true because you will, as you start doing parasite treatment, it's very common for people to start to see worms coming out, and everyone freaks out. I think it's way more common than people realize, but that's a good sign because it means you're getting the adults out, and the adults are the ones that lay eggs. So parasite treatment to me is partially clinical. I've learned over the years there are certain symptoms, types of bloating. Parasites are often more painful, like the symptoms people have, the cramping, the bloating, the digestive things are just more painful, and they come in somewhat of a cyclical fashion. Like they'll say, oh, this happens to me once a month, or it'll happen for a week and then it'll go away. So there's some sort of cyclical nature to it. And there's certain patterns in bowel movements. So it could be just people are horribly constipated, like don't go for a week, and they don't have any urge to go. It feels like just nothing, there's no nerve response in the intestines. That's when parasitic infection is bad, and the toxins released are actually paralyzing the muscles in the gut and preventing movement. So that's one. And then kind of a more common is that spastic constipation I mentioned, where people will say, I have to go 3 times or 4 times between when I wake up and 11 or 12 before I feel like it's all out. And the stool itself is often very, very narrow, like could be, as narrow as a pencil, or, maybe 2 pencils or 3, but like very, very narrow. And I'm not sure why that is with parasites, but I've had many, many patients experience that. And often lighter colored stools too. Just light brown, almost yellowish, even sometimes white, although that's uncommon. So there are some symptoms that lead you down, but what I find is often we start treating bacteria and yeast, and then suddenly we start seeing parasites, or the symptom picture changes. So that one's a little trickier. There is a parasite company in Colorado called Para Wellness Research, and he's great. It's a private lab, and so you pay them directly, and he literally just looks through the sample under a microscope, and he's been doing it for 30 plus years. So his eye is very well trained, and he can differentiate different eggs of different creatures and different microscopic cysts. And yeah, that's really what you want with parasites, is a very well trained eye, but it often ends up being clinical. because parasites just don't show up well on testing.
Yeah, that's such a great point. So if somebody gets one of those GI 360 tests, are they going to have clues that parasites are part of the picture from that? Or you mentioned a lot of clinical symptoms, which is great. Is there anything else that someone might see on a test that's going to indicate parasites? Or is this where you have to just go directly to ParaWellness research to get more specificity?
Well, the clinical symptoms paired with some of the inflammatory markers, most of the stool tests run a couple, 2, 3, sometimes 4 different inflammatory markers, like calprotectin, eosinophil X protein, beta-glucuronidase. There's a few different, lactoferrin, I think is another one, lysozyme, and all the different companies run different inflammatory panels. I can't remember right now off the top of my head which ones GI 360 offers. You can add them on to most tests too. You can add on other inflammatory markers, but the biggest one that indicates parasites is the eosinophil protein X. Parasites cause an allergic reaction in the gut, similar to what you get with nasal allergies. And sometimes it's basically a histamine response. And on blood work, it would be eosinophils, the type of white blood cell you would see would be elevated eosinophils, which can also happen in people with seasonal allergies. But sometimes people will say that they have these sneezing fits that happen every month, but they don't really feel like they have allergies. That's probably gut parasites. So anything that looks allergic in nature, or they get weird skin rashes that come and go, that's another allergic response that's caused by the body reacting to the toxins that are released from the parasites. And because parasites of all kinds, big or small, tend to be more active around the full moon, there is often really bad insomnia around the full moon. And then any of these other things, sneezing, itching, rashes, will often come in some cyclical fashion around the full moon. It sounds weird, but it's true.
Got it. Oh, that makes perfect sense. And these are just gems. Absolutely. I did not know about the eosinophils. And this is the kind of thing where people can get out their comprehensive blood profile, their latest stool test, and just look and see if there's anything that's elevated there that could be a clue that you want to dig deeper, right?
Yep, definitely. And often on just a standard blood panel that your, primary care doctor runs every year that looks at your red and white blood cells, if they differentiate them, you will have those all listed: neutrophils, basophils, eosinophils. And if anything's elevated, often it just kind of gets overlooked, like, oh, that's normal, no big deal. But if you couple that with the actual symptoms that are happening, sometimes it does give you a clue and can help you decide, do you need to run a stool test? Or do you maybe need to run a SIBO breath test? Or, even those simple lab markers paired with the person's symptoms are good clues about which direction to go next.
Yeah, that's great. So let's dig into SIBO, because this is one that I am seeing more of. And I know there are a couple of types. There's somebody that has diarrhea, and there's somebody that's constipated. And my understanding from the research is that about 80% of people that have IBS, irritable bowel syndrome, present with SIBO. So I think this is something that's significantly underlooked, underdiagnosed. And let's talk about what symptoms somebody might be feeling to be able to differentiate SIBO.
Yeah, so SIBO is typically the bloating. People will say, oh, I just feel bloated all the time. And then when you ask specifically, they'll say, oh, I wake up with a flat belly, and then by the end of the day, I look 6 months pregnant. And literally, I've had patients send me pictures like side profile where they literally do look pregnant. And that's the trapped gas. So the hallmark of SIBO is trapped gas in the small intestine. And the small intestine is not designed to move air. It just can't do it. The musculature is not designed to move air. It can only move solid matter. So the bugs that are living in the very end of the small intestine are fecal organisms that we get typically from food poisoning, like we ingest E. coli or whatever else. Or sometimes they can backflush from the large intestine into that lower part of the small intestine because there's something wrong with that valve between the two. But either way, those organisms that should be in the large intestine or the colon end up in the small intestine. And because it's pretty clean in there, they've got free terrain to just grow and proliferate. And because they're down so low, the thing in the small intestine, which is, 20 feet long, they're at the very end. The thing that feeds them the most are fibers, things that aren't broken down and absorbed earlier on. So most of the fiber that we can't break down and digest and absorb in the small intestine ends up in the large intestine. But as it passes through that area where those organisms are, it feeds them. They eat it, they digest, and they produce either hydrogen or methane gas. Or there's now another newer type of SIBO called hydrogen sulfide SIBO, which is completely different and has a different constellation of symptoms, but it's from sulfur-producing bacteria. So one of the things people will notice is when they eat anything high in fiber, like they eat brown rice or really fibrous vegetables, salad, anything like that. Apples are a huge one. I've had a lot of people say just a raw apple will make them feel so bloated. Probiotics often make people with SIBO feel extra bloated because they get trapped and then where they shouldn't be, and they add to the problem. But the real classic thing is that trapped gas. It can be extremely painful, and there's no burping or gas. Nothing moves, and the only thing that makes it go away is time. You go to sleep, you wake up the next morning, it's been reabsorbed into the body. People can also have concomitant symptoms that are sort of secondary to SIBO, like they can also have GERD or heartburn, nausea, indigestion, just feeling kind of gross after meals, having very low appetite, feeling full really easily. And that's just a sign the digestive system is out of balance in general. But that classic bloating is really the thing. And then with hydrogen sulfide SIBO, so if you read classically, like the hydrogen type causes diarrhea, the methane producers cause constipation. It's not always that simple. And a lot of times people have both because the methane producing bacteria eat hydrogen. So if you've got a lot of hydrogen, it's going to feed the methane producers, and you might have high levels of both on a test. The tests are a little tricky to read because of that. You kind of have to know what you're looking at. But hydrogen sulfide is totally different. It often has really, really horrible smelly gas, diarrhea, almost that seems like acute active food poisoning, and just relentless, unrelenting. Like people have been tested for everything else and they don't have an acute parasite and they don't have Clostridium difficile, like all the things that might cause that diarrhea. And they sometimes will even burp up sulfur tasting burps. That's classic hydrogen sulfide SIBO. And that's a totally different treatment.
Got it. Well,
and less common.
Got it. Well, you've given us the clues so that if you wake up with a flat tummy and over the course of the day as you're eating, you get what's called a SIBO baby belly because it is getting really big, maybe 6, 7, 8 months pregnant, no joke. And then you wake up feeling better in the morning. This is time to really get one of those SIBO breath tests, right? So yeah. Which one, tell me the name of the one that you like to use.
So there are different ones. The two that I think are the best tests out there, there's a company called Aero Diagnostics. That's the one that we use in my office here. There's also a company on the East Coast called Commonwealth, I believe is the name of the company. That's the one I used when I practiced on the East Coast. There are lots of others. I also use the Genova test because it's easy to order and send to people. It can sometimes be tricky to mail these tests to people. So I do use Genova as well.
Got it. And that's something that some people can do at home. And you get, I know it's a complicated procedure. I'm very familiar with this, that you need to really follow the directions very carefully and get off of all antimicrobials a couple weeks before you do this test. And the day before, you actually need to just eat like a carnivore diet, like zero carbohydrates. Basically chicken. Chicken for a whole day. No bone broth, just chicken broth. So yes, this is a very specific instruction. So don't screw it up, folks, because the SIBO breath test is no fun. It takes place over a course of 3 hours. And if you don't do the prep properly, you might have to do it again. So word to the wise.
And another thing that I want to add in about that is that SIBO is a recognized diagnosis even in the conventional world. So a lot of gastroenterologists are familiar with it. They understand it. The ones that are more progressive often treat it really well. But one of the downsides of going to a gastroenterologist, unless they happen to be one of these very progressive ones, is they will often do breath tests in the office, but they use glucose breath tests instead of lactulose, which is a problem because whatever you're feeding the bugs before you do the test, you want it to actually get to where they live. Glucose is absorbed very quickly in the system, long before it gets to the bottom of the small intestine. So they don't get a good food supply, and therefore they're not going to produce a lot of gases. You want to feed them something where they're going to produce high levels of methane or hydrogen, so you get a good read on the test. So glucose testing is not worth your money. And they often only do it for 90 minutes or 120 minutes. But especially if someone has constipation, their digestive system is moving slowly. So you really want to do the full 180-minute test, because even though technically after 140 minutes, they say that that's the large intestine, if someone's got very slow motility and they get a huge rise at 140 minutes and they have all the symptoms, I would still call that a positive test. But a gastroenterologist would not. They would say that that is fine. So the ways that we read the test, that the alternative and naturopathic professionals read them, is a little bit more fine-grained, and we will often call things positive that other people don't. So make sure you're going to someone who understands SIBO. When you're looking for a professional, make sure that it's lactulose breath test, and it's at least 2 hours, but preferably 3.
Yeah. Oh, that is such a great clinical pearl. And we recently saw a mutual client who had one of those glucose tests, and she had to redo it. I mean, it wasn't helpful. It wasn't diagnostic. And, this is an investment of your time and money. So educate yourself and make it a good use of your time and money. That's, I think, the big message there.
And as testing goes, it's on the cheaper side of things. Stool tests can run close to $400, but a SIBO test is $179 to $199. They're much less expensive. And some doctors will actually rerun them to make sure, which is why they're less expensive, because I think a lot of doctors do run them more than once. But it's not a huge investment compared to some of the things we test for.
Yeah. And we can probably save the treatment for another time, because that is a whole topic unto itself, is treatment for it. At this point, I really just want to raise awareness and help people figure out what's going on if they've already changed their diet, they started to work on healing their gut, but their symptoms just aren't better. So these are great, great next steps.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.